Families from across the country come to the Pancreas Care Center at Cincinnati Children's because it's one of the only centers in the nation dedicated to caring for children with pancreatic disorders. Our specialists treat conditions that are recurrent and hard to treat. In most cases, treatment when your child's pancreas becomes inflamed is non-invasive, and we help families with medical approaches to manage your child's symptoms and pain. But sometimes that's not enough. That's when it's time to consider surgical options.
We offer all types of surgeries here at Cincinnati Children's for children with pancreatic disorders. When we have a patient that has failed medical approaches for management of their symptoms, that's when we consider surgical approaches.
Procedures can range from diagnostic tests that allow the doctor to examine bile ducts with an endoscope, to surgeries to remove tumors, or ways to improve drainage, or reconstruction to help the body properly digest food. Mallory Crum needed a complicated surgery with a complicated name, TPIAT, or Total Pancreatectomy with Islet Auto Transplantation.
The goal was to remove the source of her debilitating symptoms, remove the source of the pain.
We were just in and out of the hospital. I had to remove her from school. We couldn't go out as a family. There was just nothing that was helping this disability and this being able to control the pain and the nausea and all that stuff other than hospitalizations.
Simply put, TPIAT is a procedure that lets surgeons remove the pancreas, take out islet cells, the cells in the pancreas that make insulin, and put those islet cells into the liver. Patients then take pancreatic enzymes to help them digest food. And some patients develop diabetes and need to take insulin.
And if you need to take insulin once a day, or if you use an insulin pump and do full insulin replacement, it's doable.
For Mallory, it was a good trade-off.
Mallory has autism, and when you ask her in the past, how is your belly, she would say not happy or sad. That's how she referred to the pain. And after the procedure, when we asked her, she would say happy. We could tell that from her interactions with her family, with us, that she was really able to go back to the normal function that she kind of lost before this procedure.
We want to keep people functional, active. We want them to be in school to the best they can be. We want them to be exercising, all the sort of normal things that everyone else takes for granted. People, who come to see us can no longer take that for granted, so we really spend a lot of time working on that.
This is something we commonly see with Cincinnati Children's being a tertiary referral hospital, and with us having a pediatric Pancreas Care Center. We do get referrals often with acute, recurrent, and chronic pancreatitis.
Life is much more manageable now for Mallory's family since their days of dozens of hospital stays for chronic and painful pancreatitis.
She's able to swing, she's able to swim, she's able to play outside, she's able to run and jump, just things that a child should be able to do.
We went so long with her being sick, it felt like it was life-changing. We kind of got back to like normal families get to do, like vacations, and people take for granted a trip to Walmart or a grocery store, and that's something we wouldn't do that. We couldn't do that. We're back. We're a family again.
Our family-centered approach may be the right fit for you, too. To learn more about the Pancreas Care Center at Cincinnati Children's, visit cincinnatichildrens.org/pancreas.